Hi, it's Jessica DaMassa with WTF Health. I'm here at Bayer G4A's Signing Day program, and we're talking to the startups. So this is Dean. He's the Vice President of Business Development for Prevencio. So good to have you with us.
Great to be here, Jessica.
All right, so tell me a little bit about your company. You guys have a panel of biomarkers that can help detect cardiovascular disease. What does that mean?
Well, it starts with taking artificial intelligence and selecting proteins in combination that get fed into algorithms that give us scores that really are delivered as blood tests that can more accurately diagnose and predict various cardiovascular conditions, like, do you have blockage in your arteries? What is your risk of heart attack or stroke, and other cardiovascular conditions?
Okay, so those who may not be familiar with how blood testing goes, who may not be a clinician or whatever. So talk me through this. Is it you guys are dealing with the samples once they're already taken? I mean, tell me exactly how it works.
Yeah, it starts the same way any blood testing is done. In an emergency room or in a doctor's office, you have your blood drawn. It then gets sent to a laboratory. That's where the difference begins with Prevencio.
Okay.
Instead of looking for one individual protein to diagnose a condition, we actually look for multiple proteins. We then take those proteins in combination along with information about you, the patient, and feed it into an algorithm. It cranks through that and gives you a score. The doctor looks at that score and says you're at an elevated risk or you're at an elevated condition for whatever they're trying to diagnose.
Okay, I have a bunch of questions on this, so we're going to have to go through this like piece by piece here for me. All right, so the biomarker piece of this is something that's proprietary to you, correct?
The combination is.
Okay.
The biomarkers are kind of run-of-the-mill biomarkers.
Okay.
The difference is that we've identified a signature or combination that is highly predictive or diagnostic in terms of identifying a particular condition.
Okay, do you have to know which condition you're looking for, or is it testing for an array of conditions?
No, it's for a specific condition.
Okay.
We actually have 6 tests and growing for various conditions like coronary artery disease, risk of heart attack or stroke, peripheral artery disease, aortic stenosis, and the list goes on.
Okay, the AI piece of this and the score. All right, talk to me about the data sets used to get to that.
Well, it starts with having a very well characterized clinical data set, and that's where our collaborations with Massachusetts General Hospital, the University Heart Center here in Germany in Hamburg, as well as the Inova Health System near Washington, D.C., has provided very rich clinical data sets with all the information we need and the blood samples to allow us to validate our test in real-time clinical use.
Okay, and speaking of that validation, where are you guys at from a clinically validated standpoint? Like, is there like a seal of approval on this yet, or what?
There is.
Okay.
We have internally validated our tests, and in 2 cases have externally validated them against additional patient cohorts with the collaborators that I've already mentioned.
Awesome, very cool. All right, give us a sense of the business. How long have you guys at Prevencio been at this?
Well, the work actually began almost 10 years ago at the University of Pittsburgh Medical Center, where researchers theorized about the use of using multiple proteins and algorithms specifically for cardiovascular disease.
Okay.
The company took a big step forward about 4 years ago when we partnered with Dr. James Januzzi, a cardiac biomarker expert, and accessed his first clinical data set related to the conditions we were interested in. It's from there that we've now presented and published 15 times at major cardiovascular conferences like the European Society of Cardiology, and been published multiple times in top-tier cardiovascular disease journals.
Okay, where are you guys at from a business standpoint? Are you raising money? How are you funded?
Yes. We are funded by private angel investors, and we are currently getting ready to open our B1 round in 2020.
Okay, everybody out there.
And we are in the process of moving forward with commercial partners who can deliver our tests on their instrument platforms.
Very exciting. Can you name any names there or no?
Not yet.
Ah, come on, Dean. All right. Well, how about a name that we can talk about? We can talk about Bayer.
Yes.
So what brought you here to the G4A program with Bayer?
Well, in addition to using our tests for patients, they can also be used for research, most notably in pharmaceutical clinical trials. companies like Bayer can use our test to identify the right patients to go into those various arms of the clinical trials, as well as measure the efficacy of the drug ongoing during the clinical trial.
Very exciting stuff. Well, that's really cool. Well, congratulations
Thank
on the
you.
relationship with Bayer.
We're
We look
excited
forward to
about
seeing what happens there, and we'll also keep an eye on you in general on that B round.
All right.
Congratulations.
Thank you very much.
I'm Jessica DaMassa with WTF Health. Thanks for joining us.